Well, good evening, everyone from South Pacific Private. I'm Diane Young here, and welcome to our Facebook Live on depression. Before we begin, I'd like to pay my respects to the Gay and Magal people and their elders past, present and emerging. This is the land on which we at South Pacific work and from where we're speaking to you tonight. I also wanted to just, from a safety aspect, say to you all, we are talking about depression, and if anybody feels that they need immediate assistance tonight, I'd be suggesting that you call Lifeline on 13 11 14 or ring 000 for an emergency. Our own intake office will be open tomorrow to receive calls from 8:30, and that's 1800 06 332. Now, I was thinking about how we might unpack depression. It's a difficult subject. Many of us have had long periods of it, or we've had periods of it and come out of it. And I suppose to set the tone tonight, what I wanted to first of all say was that there's largely accepted four types of depression. Attachment or abuse-induced depression, which comes as a result of our childhood and our childhood trauma. Situational depression, which can come into our lives as a result of a life event that's extreme, the death of the loved one, loss of work, and any major event for which we're not prepared. I mean, they can often blindside us, can't they? PTSD, depression, is often a part of that post-traumatic stress disorder. It's one of the underlying feelings that you will experience if you are suffering from PTSD or complex PTSD, and endogenous depression. So there's a number of different depressions that we can experience in our lifetime. Now, I suppose when I was thinking about how we might unpack this, I mean, if you're listening tonight, there's a fair chance that you've had experienced depression yourself, or you've got a family member, a loved one that has. And it can be very, very difficult to navigate your way through it. So I'm going to take it back a bit to the model, first of all, because when we're in our childhood, to speak of the first type of depression, the attached or abuse-induced depression, we need to, feel of value, allowed to be vulnerable, allowed to be imperfect, have appropriate dependency needs met, and be allowed to be spontaneous and open. And if, as a result of our childhood experiences, genetics, environment, we're not allowed to have that, we don't have a safe and secure childhood, we will have a very dysregulated nervous system. And of course, I've spoken to you before often about, we will go to two parts of our brain. We go to fight or flight, which is the hypoarousal, where we're driven to escape, which is more the anxious side, or we'll go to hypoarousal, where we fawn and freeze. And when we do this, we're driven to shut down. Now, if we shut down, we'll be in depression. And the symptoms are often, fatigue, sleeplessness, appetite changes, persistent unwanted thoughts, sense of hopelessness, concentration issues. We can move to sort of smoking and drinking, addiction, loss of sex drive. And of course, if you're suffering with depression, you will, as a consequence of feeling so low, avoid people and places, sit in a space of isolation, withhold feelings. We start to wall up because we feel very unsafe in the world. We have an inability to soothe ourselves or regulate our emotions. We'll often not want to tell anybody, because if you're talking to people who know nothing about depression, they'll often be saying to you, well, just get over it, or just get another job, or, get another girlfriend, or get another boyfriend, or get a whatever they think you need, a dog. Someone said that to me once. I can remember I was in a really low point in my life. I'd been sober a long time, and I'd had grief, I'd sort of moved through a lot of that. My husband had died, my baby was little, and, I was talking to a bunch of friends and saying how I was struggling, felt like I was doing life through quicksand, right? And a man rang me later that afternoon and said, I've got the perfect solution for you, Di. I went, what's that? He said, get a dog. And I went, yeah, right. Like I needed something else to look after. I could barely look after myself. Now, many years later, I did get a dog and he's been fabulous. But at that point in my life, that was not what I wanted to hear. So it really, we're sitting in a space of lack of meaning and purpose and lack of spiritual connection. And oftentimes there will be situations. If we've got a situation that's risen in our life and we don't know how to cope with it, that will be the situational depression. Now, that doesn't mean to say we don't get help for our depression, but it does mean to say we need to get clear about what is what are the things we need to do to take care of ourselves in the depression. I always find it interesting when listening to people share with me one-on-one in a therapeutic sense, and they'll be talking about, I had one man came in to see me and he said, I collapsed in the chair and he said, I think I'm depressed. And I said, oh, well, tell me what's been going on. And so he unpacked, his marriage had just broken up. He didn't have any daily contact with his children and they were in primary school. He didn't even see his dog anymore. And he was living in a boarding house and he'd moved from a very palatial home. And I said to him, well, I don't know if you're depressed, but I'd certainly suggest that you might be feeling sad. But he hadn't actually allowed himself to even cry about what had happened to him. And we did some work on repairing and, the functional things that he needed to take care of in his life. And lo and behold, his sadness started to lift after a period of time, not straight away. But he needed to reconnect with the family and start to have contact with them. One of the interesting things about depressed people is they often will be very isolated and, step back, so that they're not actually able to have any real connection with anyone. And not only do they not have connection with other people, that's meaningful. I mean, I'm not talking about going to the shops and doing the groceries, right? I'm talking about meaningful connection with other human beings so that I feel like I'm seen, like I'm heard, like someone understands what's going on. We'll often, spiral down that rabbit hole of depression and feel unable to do anything about navigating our way out of it. The interesting thing also about depressed people is if we're in a situation where people are telling us to get over it, it will just make us more and more entrenched in and walled so that we will not be able to ask for help. Now, at the beginning of this Facebook Live, I said if you're feeling like you're unsafe and you need to get help, ring Lifeline, ring 000, or reach out to us in the morning after 8:30 when the intake team starts. There is actual help for you, and it may take the form of a number of different ways. Medication in and of itself is very helpful for many people, but I know plenty of people who, for example, have had trouble with addictions. They've got into recovery. They're sober from whatever their addiction was. And then, 10 years passes and they're finding that they're not really gelling in their life like they thought they would be. Now, it could be low-grade depression, it could be situational, it could be many things. Quite recently, a client of mine came to me and has had a number of years of recovery and was not feeling great. And he came into South Pacific just to do our standalone changes program to look at his childhood trauma, because it was an aspect of his life that he had not been previously able to look at. It was too overwhelming for him, and he needed to be clean and sober and working a program to even get to the point where he was ready to do that. So in effect, after I spoke to him when he'd completed that program, which is the 5-day program, he actually said to me, I now believe that I was not only carrying shame for my family system, but I was in spiritual bankruptcy. I had started to take control again. I had started to step back from people. I thought people would judge me because I had all this recovery on board and I was supposed to be travelling better than I was. So it can be quite deceptive to just look at depression as a physiological issue. It can be also not only physiological, but it can also be partly situational and partly it's time for us actually to dig a bit deeper and do a deeper dive into our lives. I also was talking to somebody today about depression, and she was talking about it being a bit of a, the solution or the treatment, if you will, for depression to be a bit like a jigsaw. That there were perhaps physical things we needed to do. How's our nutrition? How's our exercise? Are we getting enough sunshine? Do we try and have some sense of meaning and purpose in our life? It's a question I ask a lot of my clients. Where do you get your meaning and purpose? Now, I don't mind if it's bushwalking or walking the dog, or work can give you meaning and purpose. I mean, a lot of my work gives me meaning and purpose, but it's not the only thing. So it's important for me as a physical, mental, emotional and spiritual being to have health in those 4 areas. And if I don't, something will feel off kilter. And I'm very used to being able to track how I feel, and very used to being able to look at if I'm feeling distressed or elevated in an area where I probably shouldn't. I've taken offence where none's intended. Then I've got to look at myself and not be doing this. My view about things is if I'm pointing my finger at you and it's your fault, your fault, your fault, then there's 3 pointing back at me. And the 3 pointing back at me is where the work is. It's always with me. When we work at South Pacific, we work with the whole mind, body, spirit. We don't leave anything untouched. We look very much from a psychiatric point of view, yes, but also from a holistic point of view in terms of your life up until the time you get here. Like what's happened to you? Where have you come from? What sort of life journey have you had? And, are there secrets that you keep? I mean, we often say we're as sick as our secrets. I think there's an element of people who live with enormous secrets. Well, they think they're enormous, you see, until they share them with somebody who's skilled enough to hear what's going on for them. And when it's normalised, it's like, yeah, I know, me too. Do you know, in my early recovery, I can remember telling somebody, a woman I was, just doing some meetings with, I remember telling her something that I hadn't told anybody, and I thought it was a really big secret. And, I'm struggling to get the words out, and I get the words out and tell her, and she turned to me and looked at me and she said, yeah, me too. I've done that, or that's happened to me. And I can't tell you the freedom I got in that moment when I realised I wasn't the only one. Because you see, I think the other thing depressed people do is they're prepared, they put the heaviest label they can on themselves. They often come from family systems where they've been enmeshed or abandoned or neglected. And so they will take on board that sort of common belief. Their core belief is, I'm not good enough, I don't matter, I'm unlovable. And then, this plays out as life goes on. And through that lens, it's like, what lens are we looking at our lives through, I'm going to be harder on myself, or I would have been in the past, I'm not so much now, I would have been harder on myself than you will ever be on me. And I would whip myself mercilessly for getting the smallest thing wrong, or thinking that somebody thought I'd done something wrong. So there's always this evidence of my not being able to regulate enough emotionally to look at the reality of where I am. And getting help for depression, which I support you to do if you haven't got help. And the other thing I would say to you is that sometimes people are diagnosed with depression like 10 years ago. I had one client who was diagnosed 10 years ago, and I said to him, when was the last time you had a medication check? And he said, oh, probably about 8 years. I said, well, perhaps we, and his anxiety by this stage was through the roof, right? He'd come into South Pacific, he'd done our program, he was quite successful, his business was going very well, but he had enormous anxiety by the time he came into my room. And I said to him, would you be open to getting a reassessment of your medication? He said, yeah. So I referred him to a psychiatrist here, our clinical director. And lo and behold, they went through that, medication change where they take you off one and put on another. And within 1 month, I said to that man, how are you going now with the medication? Because it had been a bit rocky, it's never easy when you're doing those changes. And he said, you know something? I have no more anxiety. And he said, I haven't had depression for years, so I'm taking antidepressants for something I'm not anymore. And my anxiety's through the roof, go figure. So do you see what I mean? Just because you were diagnosed with depression a long time ago doesn't mean to say you should necessarily just stay on that medication, and they're improving those things all the time. So I would also suggest you reach out. So physically, getting medication checked, making sure your nutrition's right. If you're not eating beautiful food and, fresh food and looking after yourself, or you're not eating 3 meals a day, taking care of yourself, getting some exercise, getting some sunshine, get out in the sunshine, have a swim, just be part of the beautiful community and lifestyle we have in Australia. So those things are critical to our mental well-being. Therapy is always good. I'd always advocate that. If you're coming out of any sort of addiction, your 12-step program needs to be, you need to keep up to date with that. And it's all, the other thing I would want to say is have a look at your spiritual life. Now, I'm not suggesting you need to suddenly become a Christian and go to church if that's not your jam, but I am suggesting that what you may need to do is actually think about what is the meaning of your life, what gives it meaning and purpose. Is there something bigger than you in your life? Look, the simple thing years ago we did gratitude lists, right? Like I'm talking 20, 30, 40 years ago. And then suddenly Oprah decided it was a good idea to do a gratitude list, and she said it on her show that you should write down 10 things you're grateful for every day. Well, it suddenly became the thing to do. Those kind of things can shift our perception, When I talked earlier about what lens am I looking at my life through, am I actually able to shift my perception, to look at my life through a different lens? And sometimes the truth of it is we all need help with that, and we need to be able to ask for help. The sad thing about depression is that we will be at this very low ebb, and I'm asking you now to get help. And if you can't pick up the phone, reach out to a friend and get them to help you do it. I don't think after pandemics, COVID, the Are You OK movement, the Me Too movement, I don't think that we're a society now that is not aware that sometimes people just need help to get through a day. And there's absolutely no shame in asking for help. We're going to take some questions shortly. So if you've got any questions, you're welcome to ask. Thank you, Tyler. I'll let Dr. Party know you think he's fantastic. And Andrew, is your mention of insufficient sun associated with vitamin D? Yes, it is. And I would always, I think we went through a period where we did the slip, slap, slop, and suddenly we're worried about skin cancer, which we should be because we live in Australia, let's face it. But always good to get some vitamin D from the sunshine. and sometimes if you're on other sort of medications, you also need to take vitamin D. I do know that because I have to do that. Is depression a singleness of focus on daily activities that become out of proportion because of the inability to change the focus onto different activities or tasks? So, Anthony, you're talking about, I think you're talking about sort of OCD, really, Anthony. But yes, a singleness of focus, and nothing exists outside that. You know, we often say to each other, look, stay in your own lane, right? Now, but I'm not saying staying in your own lane to the exclusion of actually having a look at what's going on around you. I think that we do need to have activities that bring us joy. And I know, Anthony, yours is golf, and that's a good thing, and I'm sure that handicap's going very well. Charlie, I wish I could come back. Private health has only second tier with SPM being on welfare. I therefore go to another every 3 months. But let me see what else you've saying. But see, right, it's just a safe place for me. I did changes. You die. Oh, I've lost you. Hang on, where's that comment gone? I need help from my trusty assistant here. She's the technical genius, let me tell you. Wouldn't be happening without her, the lovely Liana. I did change it. I know. Thank you, Charlie. I'm not that person who I'm right, okay. So, all right, Charlie, I'm just going to suggest you reach out if you can tomorrow to intake. Let's see if we can help you in some way. I don't know how that's going to work, but let's ask. And I do remember you, Charlie, and I'm sorry to hear that you're struggling. That's can I just say one thing about that? You know, I was listening to somebody do their first step today here, doing some clinical practice monitoring, and the client said they were broken. That's how he described himself. And I felt very much in my heart. I thought, yeah, and I can remember the days when I would say that about myself, that I was broken. And quite honestly, I don't think, from my perspective, if you'll allow me to say this, Charlie, I don't think any of us are broken. I think we're wounded and we carry deep wounds. I think often we need to be in a safe place to be able to work with the wounds. So I'm certainly hearing you there, Charlie. Tyler, can ADHD have impact with depression? Well, yes, because if the ADHD is untreated, then we're going to be messy all over the place, not get anything done. It's like, Another client came in to see me the other day and she showed me a photo of her bedroom. I thought, my goodness, I couldn't even find the bed there. So, we have to do some work, not only get treated for ADHD if that's what you want to do, take the medication for it, but also put in systems in place so we can manage ourselves, because you'll get exhausted trying to do life if we don't have the physical support to support the medication. Nice to say, thank you, Naomi, for your comments. Where are we now? Let's just go to, You're welcome. Been broken. Okay, go back down that way, So Sam, did you speak at Unity Day last July? Yes, I did. Judith, I do a lot of talking, it seems. People will eventually get sick of hearing me, I'm sure. Yep, that's good. I'm at the broken. I've been at broken, but there's a light at the end of the tunnel. Thank you, Sam. That's to you, Charlie. It's another person who's written, Sam, who's written, I have been at broken, but there's a light at the end of the tunnel. Naomi, I've broken at the moment. Well, let's see if we can't just do this wounded. Let's just look at it and can we reframe it? Because I don't think anyone's broken to the point that we can't get help. I'm trying to make that smaller. So can I just do I'm sorry, I'm having little technical issues here. Keep going. Is there a link between depression and BPD? Well, I would imagine, Jessica, yes. There is. Oh, we have to hold it, do we? Let's just see. No, that doesn't work. Okay. Sorry, I'm just having a little bit of trouble with seeing all the comments coming through. Right. Okay. So what I do, addicted gambler but get depressed. I can't gamble, not the fact that I lose all my money. PSSPP was the best thing I ever did. 31 months sober. Well, Josh, I'm very pleased to hear that you're 31 months sober. And perhaps the secondary issue is not just the drinking and the drugging, I'm guessing, is also the gambling, which can often come out sideways. A lot of men get that one. I can't gamble, not the fact I lose all my money. SPP was the best thing I ever did. Yeah, and we do need to get ongoing help. This is the thing. I mean, this is the thing. We come into SPP and we do these great programs and we come out with all this wonderful knowledge, and I've got it on, and the reality is we have to keep going. We have to keep going. Slightly off track. Once hated myself. So what is? So what? Right. So Kath has said, once I hated myself so much, but having been to SPP a number of times, I've learnt to value myself with a purple heart. That's beautiful. Thank you, Kath. Amends to my wounds. That's Costa. I've now been sober for drugs and alcohol for 5 years, and I've never done the 12 steps. I've just started the steps with a sponsor and already noticed a better understanding of myself. Go you, Jade. 5 years without doing the steps is a little bit difficult. That's kind of doing it the hard way, can I just say. I have to say, I think I was sober 4 years before I did the steps. It was a different animal then, but it's certainly changed my life. And I've done a number of runs through the 12 steps as I continue to get sober. That's beautiful. Thank you. Right. Now, I really, we're probably coming to the end of tonight. I'd like to just say to you, I'm really delighted that you're able to join us, that you're able to log on. I think life's a complex thing, and I think we often, Anthony, asking for help, Naomi and Josh and Charlie, is the hardest thing to do. My biggest defect is still self-reliance. Chat with people who've experienced those issues you're going through. Anthony, that's wonderful advice. Thank you. And Jade, I've always done it the hard way, diet. Well, up until now, how often should you check your antidepressant unit with a psychiatrist? Well, certainly at least once every year, if not every 6 months. They'll give you the guidance, but I wouldn't be changing, because we're changing. Metaphysically, we're changing as well. And our circumstances are changing. And often when we get onto the medication, things will start to right themselves, and we think, well, I'm all good now. I think, yeah, well, you are all good, but you're only all good because you actually put all that effort into getting that way. Let's keep going. So, yeah, I'm just checking if there's anybody else. Thanks for the gratitude, Sam. Okay, so oh, hang on, I've lost the message that just came through then. Where is it? There it is. Sam says, anyone thinking about it, get in there if you can. And just go back up, there's one there, just one here, yeah. Sue, I suffer from depression from food addiction. When will this be recognised as an addiction? Well, I think in our world at South Pacific, it is recognised as an addiction. There is no reason that we wouldn't think that food is an addiction. There's a myriad of disordered eating patterns, or disordered eating or eating disorders, depending on where you are on the spectrum. And it can be a very difficult one. Many of the other addictions, you can go into abstinence, but we've still got a food. So thank you, Jade. Yes, Aaron says, thank you, Di. Always insightful. Reach out if you need help. So Amber Lee says, I'm going with my private health insurance. 2-month wait period is up, so looking forward to it. And, we're absolutely ready and waiting for you to come in. So this is very, it's very powerful, isn't it, how it shows up in our lives. The depression, what the underlying causes are. And there's always underlying causes. Always. And even if we are chronically depressed and need to be medicated every day, we will find that looking at and working with the underlying causes will help. Right, okay. Okay, Charlie, I've got that message that we need to address our relationship with Medibank. It's kind of a bit out of my realm, but I'll certainly, we actually do act on the comments that are made. And Karina says, Amber, check if you can access your mental health waiver sooner. Costa says, refined sugar is powerful. Most powerful symptom, and I need to focus on progressive eating and not perfect eating. That's very wise, Costa. You see, we often want to be perfect at things, don't we? And it's not even real. I mean, I'd rather be perfectly imperfect any day and make a mistake. Most of the mistakes I make in my life are not life-threatening, that's for sure. So if I can take that whip away and put it down and be a bit easier on myself, love myself and be open to what's available in terms of help, then we can get help. And it is available in some form, and I'm reading all the messages that people are sending through. And I do want you to think. I do want you to think about what you need. It's very interesting what presents. Do you think you might do a session on being a support person? Well, we could certainly consider that, Marianne. And this is a support person in terms of, Suzanne says, I used my mental health waiver to get private insurance straight away, then was booked straight into SPP. So there may be help to get in sooner rather than you think. And I think sometimes we just don't ask the questions, do we? So when Marianne, when you're talking about a support person, I'm not quite sure if you mean a support person to somebody is depressed, or just a support person for somebody who's in addiction, or both. So do let us know. So we're going to wind up now, and I'm conscious we've been talking about. Thank you, Charlie. I'm conscious you've been talking about things that are going to elevate us, and I'm also conscious that sometimes I can talk at these events and make it sound like it's just a bit it's simple, and I don't mean that. I don't think it's simple. I think or make it sound like it's easy. What I'm trying to do is make it sound like it's simple. You can reach out for help. There is help available. Even with financial difficulties, you can go to your GP and get a PSS referral to see a therapist for free. And I do know that we all together can recover from our life and our life experience, for what has been done to us, for what we have done to ourselves, and for just the fact that we're in life and life happens around us, and sometimes we don't have any control over those things. So often depression can be, living very much in the past, anxiety, very much terrified of the future, and I do know that we can rest in the day today, know that we've done the best we can today, and I'm reading your post, Marianne, saying you've got a couple of addicts in your life, both have done your course but still struggling. I wonder if I could be doing more. I would always say to you, Family Education Day, for us to learn about addiction, if you haven't already done that, Family Education Support Group. And really, that 12-step program, Al-Anon, is very helpful for people who are living with addicts and alcoholics of any, addicts of any persuasion and alcoholics. So I want to thank you for being with us tonight. I also want to remind you about Lifeline 13 11 14 if you need to talk. And I also want to remind you to ring 000 if you're in an emergency situation, because you're worth getting help for. And remember, intake is open from 8:30 tomorrow morning. Thank you very much for being with us. And I'll see you next time we're doing Facebook Live, which will probably be in a month's time, I imagine. I think there we are. The Family Education Day has been posted. If you want to have a look at that, it's a very good program for people who are struggling with addicts, because addicts and alcoholics can take up a lot of airspace in your life if you're not the alcoholic and addict. Thank you very much for the blessings and the gratitude. Chelsea, good to hear from you. And let's just finish with the sense that we do tomorrow better than we did today, and that if you need help, you'll reach out and ask for it, because it is available. Thank you very much, and we'll see you in a month.